All right, it's Monday right here with us on Coronavirus Inside the Arizona Numbers. Usually Mondays are a little slower, but there was a lot happening Friday after we got done here with all of you. So we'll talk about that in the form of a very specific dashboard that came out that can help us all learn a little bit more about our communities, even if it was designed for schools. So we'll look into that. We'll get to know your specific neighborhood a little better. And as always, walk you through any questions you have about the data and the numbers coming out of Arizona. Let us know where you're watching from. It's always fun to see that in the comments, where you guys are joining us from. We help you dive into the Arizona numbers, but a lot of people say they apply it to the numbers in their city or their state, and it's helpful for them as well. I'm Katie Raml. Alongside me, I have to point the other way. We're on opposite sides. Somebody pointed out last week. Alongside me, Garrett Archer, and he is our data guru who helps us really take a close look at these numbers. So let's get right into it, Garrett, with where we start today. Mondays are always typically lower on the summary page, but let's start there.
Absolutely. So yes, I have the summary page pulled up. Over today, 468 new cases. That's the lowest number of cases reported to the AZDHS in a 24-hour period since June 1st. So even with Mondays being a low day, this is the lowest since June 1st. And the number of reported deaths today is 0. And again, we've talked about how on Mondays, deaths typically aren't reported or has very little reporting because a lot of the county medical examiner offices are closed. But we did, just to show you how this kind of works here, if we click on Maricopa County, we can see that actually one death was pulled back from the Maricopa County numbers, either because of further verification or something to that effect. That the health departments are working on. And then when you look at Coconino County, you have one new reported death. So that's sort of how those zero out right now. That's how we got to the 0. We've had a -1 before, and that was because of Maricopa at the time. And so just to show, this is how it shows up.
Yeah, and as we've reminded folks, likely we'd only see this case happen on a Monday. Sadly, we have numbers throughout the rest of the week that are showing up within there. Some of the comments, people, most of you are watching from Arizona, and we love having all of you here. I see some people from Minnesota and Montana. Welcome in as well. Missouri and Oregon, Chicago as well. So thank you all for letting us know where you're watching from. Let's get to more of the numbers on this page. And specifically in Maricopa County, as you show us, we're about to pass the 130,000 cases here in Maricopa County.
Yep. Looks like we'll probably pass that either tomorrow or the next day, 130,000. And of course, remember that those 130,000, that's over the course of the entire pandemic. Mm-hmm. So, that doesn't mean that there's 130,000 confirmed cases walking around Maricopa County. It's much less than that. It's probably closer to 10 to 20,000 cases walking around Maricopa County at this point.
So that plays into that recovery number. And I already saw some people asking about that. So the way that you work those recovery numbers, you take the entire number throughout the pandemic, sadly subtract the deaths out of it, and then sort of date the cases to see if they perhaps aged out. Now, we could always have long haulers. Those are the people who are sick for a very, very long time, who are in the fight of this for many months and months. But as a general range of numbers here, that's what you get to.
Yes, and I do see some comments on the comment screen talking about numbers coming from the CDC and how do we know if they're accurate. And just to sort of tell everyone how that works is these numbers do not come from the CDC. They do not come from the Health and Human Services. They come from the hospitals and the health departments here in the county and the state. They do not go to the CDC until after we see them. That is a sort of a rumor or misnomer of what's been going on, as people think that there's been manipulation by the Health and Human Services, and that's simply not the case at all. They don't see these numbers. They see these numbers after the fact, about a week or two afterwards. So we're seeing them much earlier than they are.
So a couple of highlights that areas of note that we want to talk about today. I want to get to that. And I also, Garrett, want to move on to the hospitalization numbers. So as I let you load those screens, I'll let folks know kind of two big things that are happening today. The Queen Creek School District, Queen Creek went back to school today. So those students started this morning. We'll have full reporting on that in our afternoon and evening newscasts about how things went over there. And then also some of the gyms over the weekend applied for reopening and were allowed to reopen. A small handful, but most of them were opening as you sign up for like a slot. So you sign up for a time frame to go and work out. So we want to keep you updated on those two developments, both schools and gyms. We'll get to more on that in just a moment. But meantime, Garrett, how are the hospitalization numbers looking?
I have them up as well. So this is very interesting. We are now at the point on the inpatient COVID-19 where we're basically at the ground level of before the hospitalizations began to swell. You can see 1,182 inpatient. That's general acute care, not ICU. Just anyone that's not in a maternity bed that has COVID-19 that's essentially an inpatient is any bed in a hospital that isn't an ICU or in a maternity bed. There's about 1,182 COVID-19 patients in there. You can see the beginning of the curve starts around there on June 4th, and we are already lower than that mark. So we're basically at the point where we were in just at the beginning when hospitals began to swell. We've already surpassed that. We're now lower than that at this point. Ventilators also went down today. Not much from yesterday, but you can see a large step down from right here. It was about 284, and now it's about 260. ICU. You can see it's a little increase, but again, nothing that is a trend. Still a pretty significant decrease from the week before at 430 now. Discharge also lower because there's simply less people in the hospital on COVID-19. Emergency room visits, it went up from yesterday, but as you can see, this is a noisy graph, and we're watching the trend. You can see it's sort of bent a little bit. It didn't go down by a tremendous amount, but it's still going down. And then the intubations, that's gone down slightly to 62.
So Garrett, we're seeing this sort of descent in a lot of these numbers. Have we like bottomed out in that, or do we still have? I mean, obviously, we would like to see zero on all of these situations and see everybody healthy. But are we over the peak and down on our descent, or have we kind of reached a bottom where we're just going to hang out for a bit? Is there any indication of any of that right now?
Well, where we want to look for that, there's two places you want to look to see if we've reached a floor. And I'll try to get something together that's a little bit more just one single graph with an average. But you want to look at the emergency room departments. These are the visits that are, these are, people who come into the emergency room and say, I think I have COVID-19. These are symptoms. And they are, because they are verified for a doctor as a possible or probable COVID-19 patient, they are assigned and put into this graph. So we look at this to see what movement this is having, and you can see this has slowed down some, and we want to see if this is going to be a floor, if this starts to basically just gradually go along this line right here, which is obviously just a much more gradual descent. And then, of course, the general inpatient. This is obviously very important because this is where most people, if you're going to go to the hospital, you're going to spend time in the inpatient before you go to the ICU in most cases. So we want to see what happens here. Do we start seeing a floor here, or does it continue to just on this decrease? The interesting thing is you see about this decrease is we as so far have not detected any even change in direction. It has just been a pretty substantial and aggressive decrease since the top and on around July 12th. There's no change really in the curve. It's maybe a slight one, but it's very slight. It's gone down and it keeps going down.
Yeah. Candace writes, and here we go with the political arguing. Candace, I agree. We're seeing a lot of arguing in the comment, and if y'all want to fight, there's probably a better thread to go fight on. We're here to help people understand the numbers and help people who want to learn and help people who want to find this information in Arizona so that they can make the best decisions for their lives. We're not doctors, and we're not here to make decisions for your life. We're simply here to help you find the data that you're looking for so that you can be informed informed on what's happening here in Arizona. So if there's a specific question about the data, we can definitely help you find that information for sure. And one of the best tools to do it, Garrett, is this new chart that came out this weekend. Boy, I wish it came out earlier on Friday, but we were trying to be patient, and the timing of it meant that we could really dive into it over the weekend. And the people who put this together really put a lot of hours in behind it, because this thing's neat. It breaks down not only by district, but by zip code, by city. It's a great way to see how your neighborhood looks, even if you're not interested in the schools. I know a lot of people have their kids and grandkids considering when they're going to go back, but really this is applicable to any neighborhood. So this is great to see. We're looking at, though, a lot of red on this map.
So let's kind of preface this. It was interesting because it's a great segue. Henry in the comments was like, "Oh, what's the worst part of Phoenix?" So it's like, well, Henry, we can actually answer your question now when we couldn't before. So this is the database. This is the dashboard that we were promised by Maricopa County Health Department that basically does a deeper dive on the COVID numbers at a more localized level. And specifically, this dashboard is giving us data that for Maricopa County that the AZDHS does not give us, and I'll show you what I mean here. This is the by city. I'm going to start here and go down, but let's just click on Phoenix. What's interesting about this is it gives us data. Like I said, we can't get this percent positivity number by a local area. We can't get that from the AZDHS. All they give us is by county. This COVID-like illness, which is the surveillance algorithm that the CDC uses, we can't get that by locality or region. We can only get that by either county or by these quadrant regions of the state. And they're giving us 2 weeks prior data. This is just a fantastic amount of data that they're giving us. And we can sort of track each area. As you can see, this uses the same coloring scheme that the state does, with the red being substantial, yellow being moderate, and green being minimal. We do have some areas in the state, in the county, that are already considered moderate by these standards. Gilbert, for example, you can see their percent positivity, their cases per 100 are under 100. Their percent positive is under 7%, or under 10%, excuse me, that's the threshold. And then their COVID-like illness is 4%. So Gilbert is solidly in the moderate and has been for several weeks. You come up here to Cave Creek, and it looks like they actually have no data for this last week, so we're not going to look at them. We'll look at Fountain Hills instead. Same situation as Gilbert, but then you go to some place where we know was hit pretty badly. So we'll go to like a small area down here in Goodyear, and you can see 145 per 100K in the last week, and then 13.3% positivity. So substantially higher than what you see in Gilbert. And to answer Henry's questions, it does appear that in many cases that the west side of Phoenix was hit. Obviously, when you look at this map, the west side has been hit harder than the east side.
And Garrett, when you're pulling that up, Vicki was just asking for the address. I think she got it. It was posted up in between, and then she just wrote, "Thank you for the address." Vicki, you're welcome. We'll make sure that it's back up for everybody who missed it. It's right there on your screen.
I'm gonna bring it in. Oh, he's got it. Okay, good.
He's got it. Thank you, producer Josh, for adding that up. It's a little tough to find. I wish it wasn't buried so deep on the site, but it is what it is, and we can find it on there and dig into that information. When we pull up the chart itself, Garrett, it shows 2 weeks, and that's key for folks who haven't been following this as closely, because we need 2 weeks, in essence, in the green. Like we don't just need 1 week. We
Yes.
really have to hold on to this for 2 weeks.
Yes, and this is the same. They use the exact same calculations as the AZDHS when it comes to how much backlog they give it. So when we look at this most recent week, this week one, this is actually 2 weeks ago that we're looking at. They're using the same calculation. Someone asked for Mesa. Here's Mesa. You can see Mesa is just right here, just over the per 100. Would likely be under per 100 by next week, although they do have some work to do on the percent positive. It's at 12.27. They may have at least 1 week calculated at yellow next week, but they won't be shown as yellow unless if the trend continues. They will show to yellow in 2 weeks from now, and this recalculates on Thursday, similar to the the ASDHS. Someone asked for Apache Junction. When I see zeros, just so you know, zeros are one of those things that I'm always curious about. I think what the county is doing is they're only looking at Maricopa County data for Apache Junction. As we all know, Apache Junction is almost all in Pinal County. So I wouldn't look at this and say, wow, this is really good. We're probably talking about, I mean, if we zoom down here, we're talking about pretty much this little area right here, which is in the county. So I would be worried about the Apache Junction data because it's just really, really small. So, but let's go down one level. We're going to go down to the Unified School District level because there's been a lot of talk about Queen Creek. And we're going to talk about this. And Doreen, hold that thought. We'll get to your zip code in a second.
Yeah, Doreen's asking for Chandler, and a lot of people are putting their zip codes in. We have, this is early on in our conversation here, so we'll be able to dive through a lot of these zip codes and help you all find it. So hang tight with us here for a bit. So you're talking Queen Creek?
Yeah, we're going to look. These are the unified school districts in Maricopa County. You can see you do have a couple yellows here. You have the Gila Bend, Scottsdale, Fountain Hills, and I believe this. I don't remember. I think this is the Cave Creek Carefree. Yeah, but let's and that's Higley right there in the East Valley. But let's go to Queen Creek because they obviously are open today, and so we can say, okay, where are they on their opening, and why did they make this decision? Well, you can see that in this most recent week, Queen Creek has a per 100 of 80 and a percent positive of under 5 and a COVID-like illness of under 5. So they have two metrics, at least for this last week, that are in the green and one in the yellow. They do have from 2 weeks ago this metric in the red right here, these two. But as you can see, by next week, Queen Creek will be recalculated to yellow just because we already know what these things sort of look like. So we know that this will be yellow by next week.
So and some of these, Garrett, they are starting school technically in the red.
Yes, they are starting school in the red. That's exactly right. And next week, yeah, after this recalculates, they'll still be in the yellow. Yeah, they'll definitely, they are starting right now in the red. That is true. And here's Mesa. You can see Mesa, same exact situation. They have a fairly high per 100K for the district right now. We're going to be looking for that to go under 100 at least 2 weeks from now. They'll be put in the yellow. The percent positive, it's fallen by 2 points, which means it might be over. It might be in the yellow next week. It may not be. We're going to have to sort of wait to see what happens. Let's go to some, in fact, let's bring it down. We're going to go to the high school districts. You can see most of the high school districts are on the southwest side of Phoenix. And we already know just by looking at the data from the zip codes at the AZDHS that this is pretty hard hit areas. You can see Tolleson, 235 per 100. In order to get to yellow, that has to be under 100. They are very far from that at this point. Their percent positive, almost 19%, quite far as well. It's going to take Tolleson a little time to get in there, at least 2 to 3, maybe 4 weeks for Tolleson to get into the yellow because of these high case per 100 numbers. And then we go down to elementary school districts. And you can see these sort of also mirror the same area, but they're also smaller. So they have the same problems. These regions, you've got 216 in this Glendale district, 18% positive, same situations here. They've got a while till they get into the yellow. And then I'll just show the zip codes because people are talking about the zip codes. So here's the zip codes. This is what they look like. And some of this is going to be better data than not, because obviously the more granular you get in localization, the more noisy the data can get. So I know Doreen wanted Chandler. There's 85224. You can see that it's still substantial. But
can you read what's on the screen there, Garrett? I know it's small on people's phones. So what I can see the yellow and the green, but what percentages are on there? I'm
going to show, okay, so the percentages for 85224, for example, which I think I'm still on, I am, is 86 per 100K. So it's already in the yellow, 8.39. So it's already in the yellow. And then the COVID-like illness is at 4. So it's in the green already. The reason that 85224 is still considered substantial is in the 2 week period, which is actually closer to 3.5 weeks ago, it was at 143 case per 100. So it's very likely, and in all likelihood at this point, by Thursday, this particular zip code will be recalculated to the yellow. I do wish I could get all these zip codes in, but I don't know them all by heart. So
I know there's everybody's typing their zip code up. You know what? I'll tell you. Producer Josh, can you put that specific address up there again? So when folks get done with this, they're able to search this database for themselves. It's such a handy tool. Garrett, have you heard how often it's updated, and even more specific, maybe what time? Is it updated every day?
They update this every Thursday.
Okay,
And
so it's going to be right in line with the
yes.
information that we get out from the state
Yes.
on the color-coded sheets. All right.
Yeah. They say 5 p.m. on Thursday is when they're expecting to update. So that's sort of when we're going to be looking for color changes.
Yeah, for sure.
85043. This is this was a very hard hit area. It's one of the top zip codes in the state as far as the number of COVID-19 cases. You can see case per 100 from 2 weeks ago, 312, well off the 100K mark. 24% positive, well off the 10% mark. And then the week prior that, again, it's actually increased. In 2 weeks ago, it was, or 4 weeks ago, it was 298. Now it's 312. So this is a zip code that's going to take some time to get into the green. I'm looking for another one that I know is a big hotspot. Here's another big hotspot, 85301. And that's at 250 and 16% positive. So I would love to do all these zip codes, but please go to this URL and check out your own zip code. Yeah, I would love to, but I don't know them all by heart, so I do apologize.
Well, no, that's okay. That helps. Let's see. Asraf is asking, how old is that data you guys use to update your site? So this site would only be updated, as Garrett had said, every week. If you want the daily updates, those are the numbers. So what we're looking at here, Garrett, is the percentages. And what we were getting daily on the summary page is the actual numbers. So you'd see like the number of cases. You still see some percentages on there, but this is a really drilled down version. And percentages are more helpful because these zip codes vary by population. So this is giving us a truer look than what we had before.
The zip codes, so the zip codes we get from the AZDHS, they are updated daily, which is obviously a great tool. But what they don't give us is obviously that all-important percent positive. So we don't know what it looks like in every single zip code or school district. And there's a reason for that, by the way. If they did it every single day, they would be changing it constantly, simply because in such a small localized jurisdiction, you're going to have a lot of movement here and there while the paperwork's being completed. So it takes them about a week to be like, okay, we're pretty sure that these cases and these tests belong in this zip code, so we can give a percent positive. If we were doing it every day, it would fluctuate so strongly that it would be very confusing to people. The other thing I want to point out before we move away from the zip code is sort of the obvious. I want to, if producer Josh can show it again, thank you very much. As you can see in Maricopa County, the impact of coronavirus has been felt much harder in the southwest of the county of the valley than it has on the east and the northeast. And something you must know about, and some of this will be intuitive for people just because they've lived here for a while. But as you know, you sort of draw a line down the valley right here. And these are very, very wealthy zip codes for the most part. And, you draw valley, you draw another line right here. Again, very wealthy zip codes. So these are some of the poorer zip codes right here. So it really shows how COVID-19 really does and has had a pretty stark impact on those lower income areas. The more diverse Hispanic areas are getting hit a lot harder than the wealthier suburbs of the county.
Yeah, and it's one of the reasons we have to continue to talk about this stuff so that there can be more equality between these areas and different groups as well. Brant was asking about Prescott, and this, Brant, is specific to Maricopa County. I haven't heard, Garrett, of any of the other counties starting something so detailed like this as it pertains to schools.
And it's funny. I know the GIS people up in Prescott Valley as well, and I know that they're very, very good. They're just as talented as the Maricopa County folks. And so if the county health department does, and there might be one. I don't know. I haven't looked, but if the county health department shares these metrics with the GIS department in Yavapai, those people could whip up something like this in a heartbeat. They're very, very good. They would be able to do something like this very quickly.
Yeah. Mays asks, how many current active cases are there? What's the range that you estimate that for, to answer Mays' question?
I think I have to pull it up. I was sort of on this here. Just if you give me a moment, I will have that rendered and I will tell you what that active cases are, but it'll take a couple seconds.
Yeah, that's fine. As you're updating that, Mays, hang on. We'll get the answer to that question for you. Also, just globally to update you on the numbers, I told you last week on Friday that we passed 20 million cases, and now we are at 21.7 million cases with 776,000 deaths. So 250,000 deaths globally that we continue to track. Here in the US, our story, we have a major chunk of that, 170,000 deaths in the US. That is 170,000 American families that are really suffering the most in this, in the form of a lost loved one. 5.4 million cases, though, total here in the US so far. So boy, when you consider we have 7 million people here in Arizona, the fact that that is growing closer and closer to that every day with 5.4 million cases really helps you get a better idea of how many people have been hit by something like this. All right, lots of questions coming in on zip codes. Use that site. That's the best. That's the best place to kind of search it. And then, as Garrett and I mentioned, search it every Thursday night or Friday morning when you're able to kind of peek at those numbers and see how things are changing week to week. Look at producer Josh, new graphic there. That's got it right there. He's adding his own comment, and then you're able to see it. So, what range are you looking at?
So the range right now, it appears, of active cases is anywhere from about 15 to 37,000 active cases. That's the number of cases that are within either 2 weeks old, they're less than 14 days, or they're less than 28 days. Anything after that is essentially a case that, while that person may still be grappling with the impact and the effects of COVID-19, they are, I mean, for all intents and purposes, they are not infectious anymore. So it's about, like I said, 15 to 35,000 that are confirmed active. If you look at a modeling page, that will be much higher. It'll probably be closer to anywhere from 100 to 200,000 at this point, what they presume is active out there. That's because they usually add about 10 times to the number of what we have as confirmed active.
Good stuff. Thank you, Garrett, for updating us on that. Let's talk about the R naught number. I noticed we had some different states joining us, if you will, today. Alabama and Massachusetts joining us in the below 1 range. And I mean, the full error bar is below 1 within that. And we dropped actually to a 0.79. So that was I don't think we've been that low yet. We were in the 0.8 range last week, if I remember correctly.
No, we continue to have the best rate of transmission in the country, and we have held that title for about a week and a half now. As you can see, we are well under 1 at this point. And we've talked about how there's about an 80% confidence in this number. But realistically, when you're getting that far away from 1, you can just intuitively have a little more confidence that it's under 1. We've talked about how this curve is calculated. It's calculated. The entire curve is recalculated daily. And if for some reason we start having if things start to turn around, then obviously this will recalculate upwards. But until such time, since our trajectory is still and continues to be down, it's that our not number, that rate of transmission, will continue to go down as well. Right. That is RT.life. Yes.
Yep. Jennifer asks, where do you find this graph? This is the site is right up there on the screen right now. This is the one we go to because it's just so easy to read. It's got the red and green section. Then you can see how the rest of the states are doing as well. And we've seen more and more states falling into the green, which is a great sign. Obviously, there are some concerning situations across the country. Many of you, actually, a few of you were asking about this earlier. Some of the colleges, I believe, was it Oklahoma and North Carolina or UNC, both having some issues today with spread on campus. So we'll continue to hear more about that, especially at 5:30 on World News. So Jennifer writes, thank you. Jennifer, you're so welcome. We're happy to help everybody find this information and have it at their fingertips. Okay, Garrett, as we talk about this under 20 age group, and I say under 20 because it's the best grouping that we have coming from the county for our young people, that group was growing faster than we had seen throughout the summer. And I know we stand at about 12% of our cases here in Arizona are people who are under 20 years old. It doesn't give us any more specific numbers on what age they are specifically. They're not releasing that. They're just saying under 20, at least for Maricopa County. But 12%. So that has eclipsed the 65 and older group as far as sheer numbers, the percent of total cases. How do things look today?
We still remain around the 12% range. That hasn't really changed. I will just give you that number really quick. I'm sort of trying to go in two different directions here to get the per capita as well. The number under 20 is 23,000. It's about 23,662. So a little under 24,000 cases under 20. Very low increase today. Obviously, there was low increase everywhere today. It was only a 0.2% increase, very, very low. At this point, still the lowest impacted per capita group. And I'll show you a quick, and this is, I'll show you a quick graph here of what I'm talking about. This is the per capita confirmed cases by age for this age group. I've got it. There you go. And then you can see this here, right here. This is the under 20. So it sort of has always been the lowest per capita. You have the right here, the a 20 to 44, and you can see how massive that growth was as far as per capita. It's about 4,000 per capita. But the per capita for the under 20, you see substantially less than the others at this point. Okay, I can explain the rate of transmission. The rate of transmission is the easiest way to understand that is that it is if there's 100 people that get the virus, they are able to transmit it to whatever that rate of transmission is. So if there's 100 people, right now ours is 779, so those 100 people could do 0.79. Excuse me, 79 people.
Yeah, so
that's why they think it doesn't grow. Yeah,
exactly. If it's above 1, the virus is spreading quickly, and if it's below 1, they say that the virus, the spread will slow. So that's just an easy way to kind of track it there.
Yes.
Christoph is a good question. Here's a good question. Men to women ratio. Is there a chart for that? There is indeed on the AZDHS site. You're going to want to click on the demographics section and scroll down, and you'll be able to find a split there. The last time I checked it, Garrett, and you know what, maybe I'm thinking of deaths specifically because they track it that way too. More men were dying of this than women.
Yes.
It was about 60%, 40% or something like that the last time I checked it. How do things look here in Arizona for that right now?
And that is consistent across the board on this disease, across all jurisdictions. So as you can see, as far as case numbers, more women get COVID-19. 52 to 48 is the ratio of women to men for who gets the disease. But then when you head up to deaths and you look at what the deaths look like, it's a completely different story. You can see it's 57-43, almost 60-40. So men are much more likely to succumb to COVID-19 than women. I know that I'm not even going to remotely make a guess as to why this is. This is something that's going to be months, years of scientific research to figure out exactly what it is. And it's kind of beyond my pay grade as far as trying to guess why this is.
Absolutely. I know people were kind of weighing in at the beginning, and especially when we were seeing the same sort of trend overseas, we were seeing that reflected in the numbers out of Italy and the numbers out of England. And everybody's trying to figure out what that was. And as you said, and as we've talked about before on here, this will be a full college course in the future when we look back on how we dealt with this and what we learned from this. Really interesting. Let's see. Do any stats show, Marianne's asking, do any stats show the younger people getting it now are getting severe cases needing hospitalization like the older folks? Do we have the split? I know we do. We have overall, I think it was about 4% requiring, was it 4% requiring hospitalization or 9%? I'm forgetting now. But I don't know, is that split by age too? We might be able to find that on the county level.
We have it by age. It's better. The Maricopa County's data is better for hospitalization. So I'm going to hit that really quick.
So Marianne, let us know if you're watching from Maricopa County. That's the numbers that we'll use just because they're more specific and will help us find that answer for you. But let us know where you're watching from.
So I'm gonna go to that dashboard here, and you can see sort of this is their sort of cases. I'll start with their cases, and this is, you can see, about, again, same thing as it's hard to see. Sorry, let's see if I can bring it in. I cannot. 12% of the cases in Maricopa County come from the 0 to 19 age group, so the under 20. Now let's go to the age groups tab, and this actually shows what it looks like for everything else. Hospitalizations, about 5% of 0 to 19 of the hospitalizations come from this group right here, the under 20. Almost no ICU, under 1%, and way under 1% for the deaths. And then you can see here 6% for the next age group, up 13%, and then 34% for 65 plus. And that's sort of how it's breaking down right now by age.
So Paul had a really good question. And how is this of importance, women's lives versus men's lives? So Paul, the reason that this would be important in the future is because they would look into whether it was affecting men and women biologically, if it was affected because of their gender, or something that was happening socially. Like, let's say men, they found, were just more resistant to go to the doctor, or biologically something was happening in their body that was different than in women's bodies. It would be about the cure in the future. It would be about either education if it was something happening socially, or protection if it was something happening biologically. So it's of importance, so there's better understanding in the response in the future. Right now, it's, at this point, seems just to be something to look at and to consider. But in the future, it would be part of what they're learning and how to improve survival and improve outcome in these cases. So it's always important in disease or viruses or things like that to look at the demographics as well, so we can better understand who best needs protection or who we need to talk about helping socially because of this. So that's why it's looked at so closely. This chart is great, Garrett. This has always given us a lot more information on the breakdown.
Yes, and so this is why I wanted to bring this up too, because it's a little easier to read to have everything sort of laid out for you here. You can see sort of, we want to look at these numbers as far as these things right here. Everything's sort of, you draw a line right here between this information, and you want to look at this as these will add up to 100. So you can see that in the ages, again, 12%, 19, only 5% hospitalization for that 0 to 19, 1% ICU, and 0% deaths. Now, when you go to chronic medical conditions, you can see that chronic medical conditions make up about 11% of the cases out there, but they make up 12% of the hospitalizations, 75% of the ICU visits, and 49% of the deaths. Highest risk, which is chronic medical condition or being over the age of 65, you can see 17% of all the cases we've had, 42% of the hospitalizations, 86% of the ICU, and then 82% of the deaths have come from this category.
All right, let's see. One more question coming in that I just saw. Oh, but just scrolled away. Kevin's saying they're still refusing to show any recovery rates. Pathetic journalism. Kevin, we actually already covered that. So just scroll back in the video. Not pathetic journalism, just bad timing. You missed it. We talked about it a little bit earlier. You simply take the number of cases that we have, which is approaching 200,000 cases in Arizona. And Garrett talked about earlier in this video how you can find that exact range. So just a little delay in timing. What about pregnant women and newborns, Janet writes? I don't think we have any specific information out on that just yet. I know that is a huge concern, obviously, for families or moms who are worried about this right now. But Garrett, have you seen any numbers that are broken out by that just yet?
I have not, and all I know is that the CDC they just haven't been marked in that as a medical condition or a chronic medical condition or a risk factor for CDC for COVID-19 at this point. That's all I know. I don't know. Obviously, if you take the number of deaths, at least in Arizona or at least in the country, there's going to be situations where this does occur. Obviously, with infants, they have a much lower immunity at that age than a 5-year-old does. But there's just not a lot of information on that, at least in the data.
Yeah. Eileen writes, is Arizona going down in the numbers? So yes, in most cases, we're headed in the right direction. We're going down in these numbers. The big concern is, will we stay there? Because Eileen, as we talked about earlier, we've been here before, Garrett. We were for different metrics at different points, but early June, really, at this point, that's the numbers we're seeing reflected here after we went over the peak and came back down. Now it's up to our decision, everybody's decision in how they live and the choices they make to then keep the numbers low.
Yeah, and of course, the major difference, not only in the numbers themselves, of course, are fairly reflective, but we have testing now. Anybody can get testing, which is a huge difference from what it was like in June. If you recall, in June, you had to be symptomatic to get testing at that time. They were only testing targeted populations, and so we were chasing the virus from the very beginning. At this point, if anything happens, if there's any sort of situation where we start seeing surges in populations of people that, we'll see it first in the COVID-like illness numbers. If the COVID-like illness surveillance starts to go up for emergency room visits, then that's sort of our first indication that something's going to happen. And then we'll see it reflected in the actual COVID-19 emergency department visits. And then if we're starting to see this, we'll start to see it in the case numbers. But at this point, the good thing is that if it does occur, we will at least have the testing capacity to know it's occurring, unlike what happened before, where we were just chasing it by 2-3 weeks, and we really didn't even catch up until August. That's when we finally had enough testing capacity to handle this. We took this entire curve without the ability to test properly.
And I just heard something about how quick these tests could be in the future, that they could be like someone taking a home pregnancy test, that you would know right away and be able to go about your day and make healthy and safe choices because you got a result just that quick at home. You could take a test and go take a shower and get ready for your day and come back to your test an hour later and be able to see. Wouldn't that be great to be able to get to that point? So a lot of you asking, first of all, thank you for all the nice comments. You are all so sweet. I'm so appreciative of all the kind words that people are sending out. So thank you. Kathy asks, is it true? Oh, we got one more. Don, are the numbers low or down in Cottonwood?
I don't know right now. Hopefully they have some local information but what you can do for that is go to the Yavapai County COVID-19 page. I'll pop that up really quick. It's really easy. They have a really good page. And I believe it does have information by locality, although to be honest, I have not been tracking localities in Yavapai. But so it says, for example, I've got it pulled up already. There's about 2,167 cases, 73 deaths, and 775 recoveries in Yavapai County. Cottonwood right here, 259 of the cases throughout the entire pandemic have come from Cottonwood, and that's about a +1 change. You can, the nice thing about Yavapai also is they break down the ages a little bit more. We have a 0 to 12 and a 13 to 17 in Yavapai County. So
we're really getting a lot of information from that particular site. It's nice that they're breaking it out by city. So that's the place to check. Hopefully we got that question answered for you. And let's see, here's Kathy's question. Is ASU testing separately and withholding their data? They're still reporting their data to, their data is definitely going to the state, but they're not presenting, here are ASU isolated numbers for us to see.
Correct. Everything they do is reported to AZDHS, but they will not show us, like, this is what our faculty and student cases look like. They are basically saying you have to look at that. If you want to look at that, you look at the zip code map. And well, we know ASU is massive and there's students coming from all over the place. So it's probably not useful of a map, but this is the decision they made. So that's what it is.
Yeah. All right. We are running out of time. So I'm going to get to just a few things that you can always watch our newscast. Oh, she says she appreciates your response. Thank you. Let's see. Our newscasts have the very latest information. Those are coming up at 4, 5, 6, and 10 p.m. I know a lot of eyes are going to be on those newscasts because you want to see how things went at school today. A lot of people are going to be talking about that. We'll have full coverage of that. And also J.O. Combs, that was the school that planned to open today, but had so many call outs that they decided not to open. And we expect an update from them coming tonight on what they are planning to do for tomorrow. If they will have school or they won't have school, we'll have the very latest on that for you. And then tomorrow, Tuesdays have been typically, Garrett, a busy day, but now things seem to sort of be leveling off. Do you expect a bump tomorrow or just sort of normal-ish numbers?
I mean, we will see a bump from today tomorrow, but if things continue the way they have been, it will be less than the previous Tuesday. And that's sort of what we're looking at. It should
Yeah.
be about anywhere from 10 to 20% less than what we saw last Tuesday.
Yeah.
That's sort of been the trajectory we've been on. If that doesn't occur, then there's indication that we might be in the midst of a sort of the slowing down of the, we're sort of hitting that floor, as you like to say. It's still going to, we're still going to be going down, but it's just be going down slower than we have been.
Yeah. So we'll talk about all that tomorrow on our conversation right here with all of you. And remember, you can catch us on Twitter. Garrett's at Garrett_Archer. I'm at Katie Raml, one word. And you can also find me on Twitter at Facebook at News from Katie, all running together as I teach my kids in the morning and then come chat with all of you and then do the newscast. So it ends up being a long day. I apologize. And all the very latest coronavirus information can always be found on our website, abc15.com/coronavirus. We want to thank all of you for spending time with us right here this afternoon. And we look forward to so many of you joining us tomorrow as we continue this conversation.